Tengan todas y todos muy buenos días.
Good morning, everyone. It's a pleasure to start this seminar on the launching of the virtual course, Guidelines for the Management of Retinopathy of Prematurity, Prevention and Screening. This seminar contemplates includes a number of presentations, complementary views on a topic that we know is relevant and that we are very happy to learn, and we appreciate that you are also participating. As we are all used to handling this platform, but here you can review how to, for instance, how to select the interpretation so that you can make the most of the material and the presentations that you will have in this seminar. So once again, I want to thank you for your time, your participation, your interest, and with no further ado, I'd like to give the floor to Dr. Andres de Francisco, Director of Family Health Promotion and Life Course of PAHO WHO, who will give us his opening remarks. Go ahead, Dr. de Francisco. Thank you, Pablo. Ladies and gentlemen, welcome to the launching of this virtual course. We are aware, and we also have the evidence that shows the significant progress made in recent years in the Americas in the improvement of the health of women, newborns, children, and adolescents, and that, but with a different degrees of reduction of maternal and neonatal mortality. We have also made progress on preventable and prevalent conditions. However, not all the groups in the population have benefited equally, so there are still many inequalities both in among the countries and within the countries. Women and children, particularly in more unfavorable socioeconomic contexts, especially living in rural areas or indigenous people or Afro-descendants, are the ones that have the highest burden of morbid mortality. In that context, in later 2019, the world saw the great catastrophe of the pandemic of COVID-19, and the region of the Americas has had a very bad, has been struck severely hit, and that has had a deleterious impact on the access of the population to specific care, among other problems. And again, here again, those that were more severely hit are those that were already prone to have adverse effects, and including women and newborns. So under the Sustainable Development Framework, the strategy for the health of women, newborns, children and adolescents, and for the 2030 agenda in September 2018, the member states of the Pan American Health Organization adopted the Plan of Action for the Health of Women, Children and Adolescents 2018 to 2030. This plan of action was oriented to protect the progress made so far and to close the gaps and inequalities and to promote a healthy and the healthy well-being of women, children, and adolescents in the region. An important part is that in this plan, we propose an integrated approach of a comprehensive view of health in the life course to face the common challenges and barriers and to promote the well-being and health throughout time and generations. The lines of action of this plan are the following. to strengthen transforming regulatory frameworks to reduce the health inequalities that affect women, children, and adolescents. Second, to promote the universal health and well-being equitable for all women, children, and adolescents in their families, schools, communities throughout the life course. Third, to expand the equitable access of women, children, and adolescents to integrated health of good quality, focusing on the people, the families, and the communities. And fourth, to strengthen the information systems for collecting availability, accessibility, quality, and dissemination of strategic information, including data and statistics on the health of women, children, and adolescents. Therefore, we see that we highlight the need to strengthen those enabling settings, the equitable access to quality health and information systems. There are different barriers that limit the exercise of rights, including the lack of equitable access to uh, high quality health services and continuous for everybody, the limited systematic measures of promotion of health in the families, the lack of strategic information to monitor the situation, and the inequalities in terms of health, and to guide the transforming approaches for health interventions. We need multi-sectoral approaches to address the health determinants with a course of life approach. So, as we said, the impact of the pandemic is not just a hurdle, but it is also a situation that has sent us backwards, and we lost some of the achievements, and we'll need more time to go back to the pre-pandemic levels. That is why we believe that it is essential to have an integrated approach with an intersectoral approach for the benefit of the health of women, newborns, children, and adolescents. It is absolutely necessary to approach the causes for morbid mortality and the diseases in women, children, and adolescents, and the underlying determinants under the framework of gender right, course of life, and cultural diversity, and to promote the development of health and positive well-being so that the plan of action may be achieved. Mortality of preventable deaths and the existing inequalities continue to be a priority in the region, but together with that, the objectives are just as uh, priority to achieve health, well-being, and to expand the enabling environments. We need to work at different levels, from the creation and implementation of policies and programs from the regulatory level to promotion of services and interventions, making them accessible, equitable, and of quality. The participation of with the engagement of the different stakeholders and the community. From PAHO, the department the FPL department, in the context of the plan of action and the specific programmatic guidelines, we work specifically to facilitate, to promote processes to obtain our targets, producing evidence in the health in the course of life, particularly in the vulnerable groups, and the main problems to address, and developing guidelines to address those problems with an evidence-based approach, and using the technical resources and to strengthen the capacities and strengthen the surveillance, monitoring, and evaluation for accountability are the core strategies. Today, we are very happy to launch the course guidelines for retinopathy of prematurity prevention and screening. The course led from CLAPA by the department that I direct are a clear example of a product that contributes to address the challenges that I just discussed. Every year, more than 1 million premature babies are born in the region of the Americas, and they are exposed to situations and risks that can seriously affect their health and their quality of life. Both the determinants related to prematurity and retinopathy, the prevention of the disease and its consequences, and the timely approach of quality require policies, plans, and well-trained teams and intersectoral work. So, welcome everybody, ladies and gentlemen, welcome to this launching. We thank you for your participation, and especially we hope that the material that you're about to hear about will be discussed and used in the countries, not just in the health teams, but also under the framework of the policies geared to let people survive, thrive, and prosper, especially working for women and newborns in this case. Thank you.
Muchas gracias, doctor De Francisco, por las palabras de bienvenida y sobre todo por enmarcar el tema.
Thank you, Dr. De Francisco, for your welcoming words, and particularly for highlighting everything that is important among the global strategies in the Department of Family Health Promotion and Life course, and how these aspects are related from the point of view of the strategic guidelines conducted in the region. Now, let us hand the floor to Dr. Suzanne Ceruja, Director of the Center and Head of the Unit of the Latin American Perinatology Center, Mental Reproductive Health and Perinatology. The floor is yours. Thank you, Pablo. Let's see if I can open my camera so you can see me while I speak. Please, Anna, Juan, for those responsible for the streaming, please, thank you. Now, I hope you can see me. Good morning, everybody. Thank you, Andres, for your participation. This launch of the virtual course from the Latin American Perinatology Center requires that we thank two people present who are responsible for really advocating for this extremely important subject in the region. First, Dr. Juan Carlos will have the floor. He's no longer in Tahoe. He has retired, even though he's young, and also a regional advisor for neonatal health and perinatology, Dr. Pablo Duran. I think that having these passionate advocates on these subjects as retinopathy of prematurity make it a guarantee to have this 100% security that we will cover the aspects as required in newborns, in each newborn. We want a general framework, and this is because all governments, the Technical Secretariat of PAHO, and other agencies, multilateral agencies were committed since 2003 to improve the health of all. We heard about healthy life and well-being at all ages, because this is what is fundamental for sustainable development. The goal of sustainable development refers to two issues: development, a movement forward to achieve goals and to make that sustainable. These are new topics. It's different from, for example, when we speak of the Millennium Goals. And I will further elaborate, because I think that the development and the issue of sustainability will further guarantee within intersectoriality that within SDGs we can truly advance in some areas. When we take a look at Latin America and the Caribbean, we say there are achievements, accomplishments, we must celebrate them. Increase of life expectancy, reduction of causes of child mortality and maternal mortality and others. But there is a need for care, quality care. Reaching all newborns is essential to eradicate all conditions that are so unfavorable, such as the one we're currently discussing, and preventable. This is one of the fundamental issues. In order to better understand this comprehensiveness, this intersectorality among SDGs, allow me to explain something we have discussed, because newborns is perfect here. In SDG 3, we have the area of maternal perinatal health with at least 3 indicators related to retinopathy. For example, access to sexual and reproductive health, that is, that the woman and the couple may choose the best occasion or timing to have the child in the best conditions possible to have a healthy pregnancy, maternal mortality and neonatal mortality. In other words, we want things to be comprehensive and integrated. If we increase this view to SDG and its 3 indicators, we will realize that we need to achieve the main thing, and that is universal coverage. Everybody is entitled to health. Health is a right for all, and these services must be quality services. In this regard, one of the fundamental elements is training professionals. And I will now thank each of you. We have a very reasonable audience already, and I hope that each of you will really help us in this fundamental task for all, and that is to continue disseminating this course, speaking about it and inviting people to access it. We know that in order to accomplish the expected outcomes in SDGs, we really must have with us availability and quality in services. If we think of the ideal conditions, we will have access to family planning, access to prenatal quality care and newborn care, be they premature, because retinopathy is related to this situation, or severely ill. So now we have some figures. In the region, we have over 15 million births per year, approximately, close to 10%. And this changes among countries, within countries. Sometimes we have over 1,200,000 premature newborns, among them 25,000 children exposed to diseases such as retinopathy. We work so that we can prevent a pregnancy that may culminate in prematurity, leaving a child in a more exposed situation, exposed to risk. And that's why I spoke of comprehensiveness of goals and SDGs in particular, and indicators within SDG 3. We need to have universal coverage, access to family planning, quality prenatal care, and good quality care during delivery. This comprehensive approach allows us to be capable of using all our knowledge, what you'll acquire, and everything regarding prevention so that we don't have children with such severe conditions such as retinopathy. We particularly living in nearly 18 months in pandemic conditions. It's a very severe condition, and COVID has led many departments to interrupt their services due to different situations, because human resources initially were working elsewhere, funding issues, and many more reasons. In the region, close to 45% of healthcare departments in perinatology had mild to severe difficulties, and our director always reminds us that the pandemic has proven a triple challenge. We have a health crisis, surely the most important we have faced in the past 100 years. There's a crisis in social protection of those living in more unfavorable conditions with less education, income, and so on. And we have an economic crisis. Countries are struggling to re-establish their situation, and this is very important when we speak of prevention. Prevention promotes the non-existence of a certain health condition and the corresponding expenditure. In this, unfortunately, 41 out of 29 countries have shown in the survey that, to give you an example, one of the things that the Americas had was over 95% care during a hospital delivery. That is, deliveries and newborns are cared for by qualified people. For the first time in our region, this fell in a significant manner. And institutional care in some places may have reached only 45%. So this interruption we experienced in the past 18 months will impact in all SDG indicators and care. And there have been already some discussions and evidence about the increase of premature births and the consequences this entails. So this is a very timely course. We must really disseminate it, as other colleagues who are not present today may become familiar with it. It's very important. This is a complex situation and has demanded of all of us some new activities, maybe not totally new, but for example, intense virtualization. And this is the outcome also. You know that American Perinatology Center, Women's and Reproductive Health, is responsible within PAHO for maternal, perinatal, neonatal, and sexual and reproductive health areas. In PAP, we work hard, and in our website, you may find different courses and online modalities. We have many new applications recently launched, apart from all the guidelines for technical cooperation. So I invite you also to see some of our videos and different material. Pablo has been dedicated to provide everything required to implement different plans and care to the normal or newborn or at risk. The course we're currently launching, apart from its importance regarding care and prevention of ROP and development of retinopathy, is focused on some specific aspects. What we are requesting in participation and dissemination to reach a more comprehensive standpoint. And I end here. This isn't a course for neonatologists or for specialized people. No, it's a course for all people providing care, all those working in health and life course, those working at prenatal level, midwives, nurse staff, pediatric staff, and so on, and beyond, and those formulating policies who need to be clear about the plans implemented and how this is being assessed and followed. The idea is to guarantee a healthy life and promote through well-being at all ages, complying with SDG 3. I wish you a wonderful morning. Let's hear to those who have planned this course, and I hope that we have each of you disseminating this, becoming more familiar with our virtual plan. Thank you all.
Muchas gracias, doctora Cerrulla,
Thank you, Dr. Cerrulla, for your words and for giving us a framework for this topic from the perspective of the SDGs, and essentially from highlighting the importance of a comprehensive and integrated health, starting with before the conception. Although the course is focuses on very peculiar aspects, we cannot ignore that it's impossible to give a sound approach if we do not contemplate perinatal health from this broader perspective. So now, again, we thank Dr. De Francisco and Dr. Cerrulla for their words. And now we're going to have 3 speakers that are colleagues, experts, and friends that have worked on this topic for many years, who have played a key role in the development of the material that later on turned into this virtual course that we are presenting. We are speaking of Dr. Juan Carlos Silva, Dr. Shailendra Sugrim, and Mrs. Jovita Plasencia. Dr. Silva, as Dr. Cerrulla said, is a former PAHO WHO staff member, and he has led and he's been responsible for visual health for many years, and he has led a process, among many other things, developing the guideline for the prevention and the approach of prematurity retinopathy. Dr. Sugrim is the national coordinator of the Vision and Eye Health Services at the Ministry of Health in Guyana, and Mrs. Plasencia is a neonatal pediatric nurse assistant to the Neurosciences Department of the National Institute of Perinatology in Mexico. The 3 presentations will give us an approach from different perspectives, including public health, the perspective of the need to approach the prevention of the retinopathy and with a national view, and the perspective from the point of view of nurses as a pillar for prevention. So we are going to move forward in the agenda. And now I'd like to recognize Dr. Juan Carlos Silva, who will talk about prematurity retinopathy. Juan Carlos, you have the floor. Thank you, Pablo. I want to thank CLAP and PAHO for the invitation. It's a pleasure for me to be with you. And as has already been said by Susan and Pablo, prematurity retinopathy is but a component of perinatal health and neonatal health. And that is the approach that we always wanted to use. It's not an eye problem alone. It's much more than that. It's part of a comprehensive health. So now I'm going to share the screen. So I hope you can see the screen. Yes, Juan Carlos. Could you please turn it into presentation? Yes, but it's not obeying me.
Tal vez probando en el menú de arriba en vista.
If you try on top on the menu view options, on the view, for some reason it's not working. Here it is. Can you see it now? Yes, yes. It's not the first slide. It's the neonatology paper 2018. There we have it. So the first thing that I want to show is the incidence of visual impairment per 100,000 live births. We've seen frequently that this is highly dependent on the countries. It changes from one country to the other because of neonatal care conditions. It is generally said that every 100,000 live births, the incidence could range from 10 to 45 children that will have a permanent sight impairment as a result of prematurity retinopathy. In those countries, for instance, those that have 10 have a very low mortality, and they have a high screening for retinopathy, for ROP. These are countries that have seen an increase in survival, and it continues to rise. Now, the countries with over 45 cases per 100,000 as a product of ROP are countries where there's an expansion of neonatal care, but there's not enough quality and trained staff for the intensive care units. Here, in this map, I will show you the reference. So there you have the source. This is a reference based on 2013 data, but it was published in 2016. And it shows that in Latin America, we have an incidence that is quite high if we compare it, for instance, with countries with the United States or in Europe. So what I what I want to say is that we have to improve care, both of newborns and ophthalmological. And so even though there has been progress in recent years, this is one of the programs that has advanced the most. We have to do better. That's the idea. This slide, this is a recent study, 2018. And what it says actually is that rather than an eye problem, it's a systemic problem. That means that ROP is nothing but the manifestation of a problem that is a systemic problem. So we shouldn't just address it as a retinopathy, but as a problem that has to do with a syndrome of situations that have to do with the vascularization of the nervous tissues in the newborn, in the premature newborn. So this study shows that the size of the brain of children with ROP is significantly smaller. You see that the p-values are under 0.001. The most remarkable, maybe, is the white matter of the brain, because and in the cerebellum, that's also important. Now, as we measure the indices of mental development and the psychomotor developmental index, these are the most important things that show definitely that it's a systemic involvement in people that had an ROP leading to visual impairment. So the message here is that when we see a child with a severe ROP, we need to be certain that it's not just the eyes that are involved, but all these other organs may be impaired. We don't know whether there are others in addition to these, but there's evidence that the central nervous system is impaired. This is a study conducted in 2018. The pictures to your left show a child with a severe ROP, and to your right you see a control. You see that in the first case, in blue, you have the unmyelinated white matter that is much less significant than the right, that is the control. And at the bottom, you see that the cerebellum is also less developed. So it's not just the white matter, but also the cerebellum. So here, in these images, we can see, I repeat, there you have the reference, the source of this information, so that you can also go and read this if you haven't done it yet. So what do we have to do to guarantee benefits? And well, we have to provide neonatal care respecting the protocols. So what are the protocols for children in which you suspect an ROP, and to diagnose the ROP and to monitor it? These are the benefits that a healthcare system should have to ensure that the children that have a potential ROP, or whom you suspect or are at high risk of having an ROP, may be identified and treated early. What are we going to do with that? Well, we have to act on the regulatory environment. We have to make sure that there are regulations in force. And on the other hand, we need to ensure good healthcare systems and services. And we must make sure that they are well established in the national program, and with a proper human resources, infrastructure, etc. So those are two areas, and we have to act on both. In the case of the health policies, that's a study that was conducted by Arneson. There are four essential things in policies. The first is that costs should be covered by the healthcare system, either through insurance or the Ministry of Health or whatever entity with that obligation. The national guidelines, that's one of the things that we are promoting. Those are dynamic documents that change with time, and we gradually improvement based on the evidence that arises from the studies published. Law needs to make it mandatory to conduct a clinical examination of premature newborns. It needs to be an obligation. So that needs to be included in law in order to be able, so that we can enforce it and so that the entire health system may respond. And data gathering is necessary because we need reliable indicators. Here we have the steps to make the policies. So we need a multidisciplinary group, and we need an analysis of the situation of the NICU. So many countries have this possibility, and if the countries don't have any guidelines, they have to develop them and implement them. And another thing, we have to create a program because the things don't happen overnight. And so what does the program need to do? First of all, a situational diagnostic, then we have to strengthen human resources, we have to make sure that the physical area and the equipment is right, and the production of materials is good. That needs to be done by the people, by the leaders in this area. And we need a monitoring system and evaluation of services. This chart shows a remarkable difference between the the number of children and the screeners, that is the eye doctors. It shows that in Argentina, for every screener, there are 108 children, while in Bolivia there are 487.
So we need an appropriate number of people doing screening so they can cover all the needs. Here we have the percentage of provinces and departments with screening. The study was published in 2018. Here you have the reference. 100% of provinces had at least one unit that conducted screening, while in other countries had something like 40, 50%, 71%. So efforts must be made so that this program, that, as I said, not only includes eyes, but the central nervous system may reach all provinces, because this must reach the whole population. Visual and comprehensive universal health must go to all parts, even if they're small and marginal. And it's particularly there that we must work at the units, but also with protocols to provide oxygen. And what's most important here, so in summary, the approach to retinopathy must be part of neonatal care and not something separate, part of neonatal care, because it is related to neurological development in children, quality of care. When there isn't a high figure of ROP, the quality of care is surely high. This was then my presentation. Thank you very much for being here. Thank you so much, Dr. Silva. Most interesting presentation, particularly this last item of framing retinopathy of prematurity within the quality of care to reach improvement. Retinopathy is a significant marker apart from the impact it has in child development. And the second extremely important and interesting element in your presentation regarding the need to formulate in the countries actions, policies, and strategies to reach all this. In this line now, we would like now to invite Dr. Sugrim to make his presentation called National Initiatives in the Implementation of ROP Prevention and Screening in Guyana. And now the floor is yours.
We cannot hear you.
Good morning. Can you hear me now?
Yes.
Okay. Good morning, everyone. It is indeed a pleasure to make this presentation on behalf of the Ministry of Health of Guyana. Thank you for inviting me for this presentation. I will talk a little bit about our initiatives in Guyana. Now, as we all know, an estimated 15 million babies are born preterm. Approximately 20,000 of these babies will become blind from retinopathy of prematurity. And every year there's an additional 12,000 that will have visual impairment. Prevention is better than cure. So the purpose of all of these initiatives is so that we can prevent blindness for the child. And then we are all aware of the effect of vision loss on a person. It starts from physical well-being, psychological well-being, loss of independence. And for children, this accounts for a lot of vision loss hours, life in terms of a lifelong perspective of the child. So we're not only talking about adults. It's not like, for example, in patients who will lose vision in adulthood. We have to prepare these children for the rest of their lives. Now, why should we screen our ROP? It's a well-established classification system. And from the WHO principles of screening, we need to ensure that it's an important health issue. The screening process is acceptable, safe, effective. We're all aware of these various screening options. And I think ROP falls well in this screening effort. The natural history is known, and many clinical trials show that treatment of the disease, once reaches a critical state, is highly effective at preventing progression to blinding retinal detachment. Now, we're all aware of retinopathy of prematurity. It's a disease that occurs in premature babies due to the abnormal blood vessels that grow in the retina. In 5 to 10% of premature babies, ROP progresses and can lead to retinal detachment. The population at risk, about 15 million preterm births are recorded per year. Ministries of health are highly likely to expand neonatal intensive care, and as a consequence, this will lead to an increase in the survival of preterm babies. This puts them at a higher risk of ROP. Those most at risk are those born less than 32 weeks. And only preterm babies that are cared for in neonatal intensive care units develop ROP, with the principal risk factor being unmonitored oxygen levels. Factors which increase risk for ROP include preterm burn, too much oxygen, sepsis, chronic lung disease, poor nutrition, less than perfect neonatal care. So in terms of the public health approach, you have primary, secondary, and tertiary prevention, good neonatal care, reduce the number of preterm births. Of course, all of these have a lot of challenges. In terms of good neonatal care, we need systemic steroids to mothers for premature babies, oxygen monitoring of neonates. In terms of reducing preterm births, this is a more systemic approach that is needed, reducing the number of embryos, prevention of teenage pregnancies, avoid unnecessary cesarean sections. And this is a whole public health approach, as Dr. Carlos was mentioning. It's not only for the ophthalmologists or the eye care professionals. In terms of secondary prevention, we have screening and examination of babies at risk, laser treatment, and then of course, follow-up and monitoring of these babies. In tertiary prevention, we have, of course, surgical and for low vision and services for those who are affected. In terms of neonatal care, systems of delivering oxygen, using blenders, measuring oxygen levels. We need to have trained staff who understand the importance of controlling oxygen levels. Detecting the infants that need treatment, you need to be infants to be examined according to gestational age, birth weight, and also ophthalmologists visiting the neonatal unit. These are among the many strategies that we're all familiar with. With regards to ROP screening and control in Guyana, we do have an eye care strategic framework on prevention of blindness, in which childhood blindness is one of the primary areas of focus. In July 2019, a PAHO Ministry of Health workshop was held in Guyana to develop guidelines for the ROP screening and management in Guyana. Prior to this, there was a non-existent protocol or guideline, random sporadic referrals to the public tertiary hospitals where ophthalmologists would screen these infants. And this is due to referrals being sent from the neonatal units and the pediatricians. Now, so at this, that's why at that point it was decided that we needed to have a national guidelines. And at this workshop, national stakeholders and the Ministry of Health were present, including nurses and doctors involved in neonatal care. So we had a holistic approach. Of course, we had the pleasure of having Dr. Juan Carlos Silva, who was at that time the PAHO Regional Advisor of Prevention of Blindness and Ocular Health. And we were honored to have Dr. Pablo Juan, who is the PAHO Regional Advisor on Neonatal Health. Both of them were present at this function. And at the end of that workshop, a ROP working group was established to finalize and promote the adoption of these guidelines through the Ministry of Health. At that time, the plan was that the maternal and child health unit of the Ministry of Health would to collaborate with the ROP working group to implement the plan in tandem with the Guyana neonatal health strategies and the neonatal health resuscitation program. So in this instance, we were trying to bring together all of the guidelines that were existing for general neonatal health, incorporate ROP screening in this, so having a more holistic approach. Of course, in Guyana, we do have a lot of lack of data on ROP and neonatal, but with this initiative, we're hoping to have a collaborative approach that can help encourage collection of data at all levels so that we can monitor the progress of childhood blindness and prevention. I will just go through a short summary of the guidelines that were agreed on. We had in two broad categories, neonatal care and ophthalmological care. For neonatal care, it was agreed that we should use the use of breast milk for premature infants should be used due to its protective impact on incidence of ROP. There should be a creation of an alarm system to identify premature infants at risk of ROP using certain factors such as gestational age, birth weight. Supplementation of premature infants with vitamins were promoted due to effects in reducing ROP. resuscitation of preterm newborns with PPV and oxygen levels of 21 to 30%. In NICU and delivery rooms, maintenance of saturation with standard ranges in patients with ROP risk, permanent monitoring of saturation with a pulse oximeter to maintain saturation between 89 to 94, and compressed oxygen, air oxygen blenders and environmental oximeters for the periodic control of IOT are suggested for all neonatal units. In terms of ophthalmological care, screening for ROP was recommended for every newborn with a birth weight less than 2,000 grams and or a gestational week of less than 36 weeks or less. And the first examination for ROP screening is recommended according to the scheme listed there. Follow-up screening for ROP and suspension of screening to follow a national scheme based on the stages of ROP. Screening and treatment will follow international recommendations of equipment and eye drops required or recommended protocols. And then those patients, those children who are visually impaired, will be incorporated in whatever low vision or visual education, special education programs that are available. So that's just a summary of what the guidelines, and they kind of follow those that were recommended for the Caribbean and Latin American region. Now, going forward, recently this year in January 2021, the ministry has dedicated an office in the Ministry of Health for vision and eye health services. And this office will help coordinate all vision care related services in Guyana. This was lacking for quite a few years, and we've been having a lot of ad hoc advice in terms from the National Hospital. So now that we have a formal office, I think this will augur well for eye health in Guyana. We will go ahead with the finalization and adoption of the National ROP Guidelines that were drafted in July 2019 during that workshop, which I just presented on. And we will then distribute these guidelines at the national levels with pediatricians, neonatologists, and nurses working in the NICU, and all other eye health personnel. Screening and treatment will continue and follow international recommendations. We will develop a national referral and screening form that will be used across the country. This is just a simple draft I have here on the screen. It needs to be developed further. Hopefully by the beginning of 2022, we can finalize this with the pediatrician. We currently continue our screening using the present referral forms in the system, but in discussion with the pediatricians, we decided that this form will benefit a lot in terms of identifying the patients quickly that needs to be referred. At the end of this form, there will also be a feedback form that will be sent to the neonatologists or the pediatricians. A review of training and equipment needs will be done. Gaps will be identified at the various NICUs across the country and at the public hospital, the tertiary hospital. We have currently about 6 different units. Training will be a training workshop for all levels of healthcare professionals, nurses, and physicians working with newborns and premature infants will be done. Premature draft was done here. We plan to have this in mid of 2022 to train everyone involved in care. And then moving forward, there will be requests for equipment at the various health cares for implementation of these guidelines at the various NICU. Now, the PAHO, in terms of data collection, the PAHO and WHO template for data collection will be initiated. That will help us to provide an overall country status, and this will also augur research in the country on ROP, because over the past few years, this has been quite lacking. In conclusion, ROP will become a problem for Guyana in the near future with the improvement of our neonatal care services and development of more NICUs. And as healthcare providers, we can start planning and implementing strategies for the prevention of an epidemic. Now, collaborative approach of the Ministry of Health, the regional health authorities, and healthcare professionals needs to be encouraged in preterm care to combat childhood blindness. And we'd like to express our gratitude to Dr. Juan Carlos for all the work he has been doing in this area in the region. And we do commit towards moving forward in this effort. Thank you.
Muchas gracias, profesor Subrim, por su excelente presentación y por haber dejado claro.
Thank you, Doctor, for your presentation and for having said, highlighting several factors that are important. One is the important commitment and leadership of the ministries of health with authorities and experts that enabled an adaptation of the PAHO guidelines to adapt it to the national situation and the impact of the pandemic delaying the agendas. But we are confident that Guyana, that was one of the first countries to move forward in this process, may be capable of improving. We are certain that you're going to have an improvement of the quality of life. And the second element that I'd like to highlight is the identification of the approach with the involvement of the health team comprehensively. So the nurses that were mentioned and that participated in the workshop in Guyana is a key pillar so that prevention and screening may occur in a timely manner and properly. So this is a good way of leading to the next speaker's presentation, Mrs. Plasencia, that will speak of the nurses and the role in the prevention of retinopathy. You have the floor. Okay. Good morning, everyone. It's a true pleasure for me to be able to share the work of the nurses in the different areas in the prevention and the program or the problem that we are addressing today. Now I'm going to share my screen.
No sé si puedan ver la pantalla en estos momentos que le estoy compartiendo.
Can you see the screen that I'm sharing? No, not yet. Not yet.
Listo, ¿cierto?
Ready.
¿Podemos observar ya la pantalla?
So there we can see the screen. Yes. Good. Now put it as a presentation, please. Perfect, good. So I was telling you that I'm very happy to be sharing this with you, and I feel honored for the invitation. Of course, I thank the organizers of this event. So without further ado, let's start with this key part, that is the engagement of the nurses as a key actor in the prevention of retinopathy. Here, this is essential, this is important, and it's been mentioned by the previous panelists. In the world, there are about 15 million premature births a year. In the Americas, we have about 1 million. So this is an important part because, of course, it shows that we need to improve things and emphasize the care of these patients. Remember that these children are significantly impaired in their nervous system, and they have significant sequela unless we provide them good care and given their prematurity. And of course, we should be able to avoid the problems that facing these children. And although we know that there's an increase in survival of these children, but the prognosis and the function of neurodevelopment continues to be a problem. So it's one of the greatest causes of mortality and morbidity and even mortality. And it leads to chronic problems, including lung problems, and of course, today's topic, that is the retinopathy. Initially, it was diagnosed as a specific problem. We know that it's multifactorial and it's characterized by a significant disorder in the vasculogenesis of the retina that may lead to vision impairment or even to the loss of vision. And the ROP is preventable. And this is the interesting part that we need to work with. So prevention involves several stakeholders, governments, managers, funders, nurses, doctors, and of course the nurses, and it's also, and of course parents. So it's absolutely essential for parents to participate here. The nurses are a key actor because the nurses are involved in all the processes of care. So, and that care should be based on a sound theoretical framework to address the patient's needs and the family's needs and the community's need. Although the prevention of retinopathy is well established in the primary, secondary, and even the tertiary phases, I would go a bit earlier, including factors that were mentioned by Dr. Sarruya. So I'm going to talk about sexual education in adolescents because the greatest incidence of these pregnancies are in adolescents because of many factors. So I would dedicate to educate the adolescents and to discuss it with the couples that are planning to have a baby, because preconceptual care is very important. And of course, the control, monitoring pregnancies, and the antenatal care, and then the care during delivery, intra delivery care, to be able to give good care to these premature babies. This chart, I think that this chart is essential and it's very important, and it is the key to prevent the ROP in the intensive care units in these patients. We talked about primary prevention, immediate care. What happens? Well, we need to be especially careful with these children at birth, promote the stability and the sound use of oxygen, because oxygen, or the management of oxygen for these children, is one of the key causes of ROP. It's because both hypoxia and hyperoxia may be toxic. So we have to monitor the oxygen levels of these babies. The smaller the baby, the more liable, the more careful we have to be with oxygen. So with these children, we have to avoid intubation. I remember that when I started working in neonatal care, the simple fact that it was a premature, automatically we tended to intubate these children. At present, we have different options like CPAP, the nasal CPAP, to avoid intubation and the greater toxicity for these patients. The specific management of these children, the concentration and the amount of oxygen. And as I said, we need to do a good monitoring of oxygen. Prevention of infections, because that may lead to mortality and the occurrence of ROP. So we can reduce it with something as simple as following well-established protocol, packages of specific actions to avoid contamination. So let's remember that these children have depression of their immune system, so they may contaminate easily and they can develop infections, including sepsis at the neonatal intensive care unit. So we need to be especially careful with these babies using the antibiotics, because of course they may be toxic for their ear, depending on the baby's gestational age. Another important factor is blood transfusions. Of course, they are essential, but we need to be careful with infusions with these patients, and we must only use transfusions when there are specific needs. And so these are infusions that need to be avoided whenever possible. And we have to promote an immediate nutrition in the first half hour of the baby's life. We have to promote skin-to-skin contact with the mother, and to promote breastfeeding in the first half an hour. That should be a priority at the neonatal intensive care unit. Monitoring the postnatal growth is also essential. Of course, we need the specific controls and monitor the vascularization of the retina. In secondary prevention, well, the earlier we act, the earlier we diagnose or we detect the problem, then of course we are going to have better results. So, and then we have the important part of the weekly monitoring of these patients. Another key factor in this part, not only in this part, but initially I mentioned the antenatal stage. The engagement of the family is very important. We must raise awareness of the process of this child and the risk that they have and the significance of monitoring. We need to promote a discharge plan, and we have to educate the parents so that when the baby is discharged and goes home, then the parents may continue providing this care and for the better prognosis of these patients. So
these patients go home oxygen dependent and requiring oxygen. So it's important to remind parents how to control and educate them in this regard to avoid hypoxia in home. Remember that our ICU requires increasing awareness in parents of how toxic could be a significant increase of oxygen as a sudden decrease. Transfusions have been mentioned, and follow-up of stress factors in the ICU. The ICU is a highly toxic service due to overstimulation, higher oxygen consumption, and a series of situations that may worsen the situation experienced by these patients. When we speak of tertiary prevention, we're specifically referring to newborns recovered with sequelae, low vision, or even unfortunately blindness. Here, what is essential is to have early access to rehab programs that facilitate insertion in family, the community, and improvement in adaptation. And although we know that we still have significant controversies regarding the management of these children, regarding specific care in the neonatal ICUs, what is clear and evidenced is that we must conduct prevention. And in prevention, from the start, we said, is not only during birth. It includes everything we analyzed in this chart, but also sexual education in teenagers we must touch upon these issues with adolescents, teach them self-care, and particularly a particular interest in patients or couples that are considering becoming pregnant in the short or medium term, so that they have this pregnancy in ideal condition when the life conditions are best, to ensure or at least decrease the risk of prematurity or of a newborn with problems, and reduce complications during delivery and with pregnant women. This is very interesting. We use this flowchart very frequently at my center, and it encompasses all the specific care mentioned in the ICUs that may be tailored to prevention of ROP in the ICU. We must have special care with children in noise and light and temperature management, prevent toxic stress. Minimal stimulation is essential. Pain management, something that may also lead to stress in children, and higher oxygen consumption, of course, encourage at a certain point the prevention of everything favoring retinopathy, prevention of infection and sepsis. And even though it may seem tedious to refer how to manage these packages, it is very fundamental to wash your hands, apart from everything we said. And although it seems redundant to mention, unfortunately, still many shadow trials conducted have shown that the staff sometimes forgets to do so, and this is quite essential, and all the work staff should do it in the ICU, not only there, of course, but in any hospital area. And currently, with the emergency situation we're experiencing, hand washing is very essential and is a key matter, and we must learn to live with these new changes, and hand washing is quite essential. Personal care, not only in the health centers, but at personal level in the home and elsewhere where we are with other people. And we've mentioned oxygen control. This is very essential. It may be toxic or harmful for the newborn, just as hypoxia. Hyperoxia is a problem, and sudden reductions or increases in oxygen in newborns when receiving hemoderivatives transfusion, immediate nutrition with mother milk, and family-focused care. This has already been mentioned. Such a way, then, at present, our main challenge shouldn't be newborn survival, but the quality of life of these children. We must prevent all sequelae at all levels in this group of patients, and therefore we need to have a culture of change and improvement based on the evidence of care to reduce morbid mortality and sequelae in this type of children. Therefore, the nursing staff is very fundamental because they participate throughout the health process, from prevention at all levels. Nurses are key with their caring, with continuous care, comprehensive care of patients, all sorts of patients in the ICU 24/7, in such a way that we must be particularly aware of, particularly in this time of change, with the professionalization of the nursing staff, in this change of paradigm. Therefore, it is essential to conduct prevention with specific programs and improvement of care in the neonatal ACU, timely diagnosis and treatment, in this case of ROP, long-term follow-up of children at risk, with the specific goal of preventing disability, access to support programs for insertion to society in children that do have problems, in such a way then that the nursing staff, well, we know the theory. The plans and the work programs are not the problem, but their implementation in each of our departments, and particularly dissemination and making this applicable throughout the country in all units with the firm goal of preventing disability, not only due to ROP, that is a subject we're currently discussing, but of all issues and sequelae to which these sort of patients are exposed, given the lability due to prematurity. So first, I will stress importance of nursing staff for training and education and continuous education. It's true, we need specialized staff that may care for specific problems in the sort of patients. We refer to very labile children at all levels. So in the ICU, we must have perinatal, neonatal, and pediatric nurses. We need specific investment, and that is why at the beginning of the presentation we said that there are several players that must participate here. We need funding, we need the health ministries to invest on neonatal ICUs so that we will be able to conduct our work appropriately and prevent complications at all levels in this group of patients. Second, we may refer to programs and guidelines for the neonatal ICUs. If we have trained staff with the necessary specific knowledge, this will make it easier to create protocols and guidelines for oxygen management in this case, minimal stimulation protocols preventing the high stress that occurs in ICUs, and that maybe could lead us to favor complications such as those mentioned or sequelae such as ROP. Sepsis protocols, and we must implement them and conduct them. Derivative transfusions, importance of maternal breastfeeding immediately after delivery, and education and integration of the family in the care, and the education we must conduct when discharging patients so the newborns go back home. Another essential part we shouldn't lose sight of in all actions is evaluation of indicators and improvement programs. If we don't evaluate the work done, if we don't measure it, if we don't measure this work, we will not be able to realize how it is being done, and we won't have improvement programs leading us to a better quality of care in this sort of patient. So we must follow all these processes through assessment and well-established protocols. Another key matter already mentioned is coordination and alliances and the physical, the material units, the saturometers for oxygen to manage partial oxygen saturation, oxygen blenders to control the oxygen and the quality of oxygen being administered, the specific mixes to prevent sequelae or consequences of in this sort of patients in such a way that we need the ministries of health and different companies to participate, NGOs, the pharmaceutical industry, civil society organizations. We must ensure rehabilitation and integration of educational programs in sort of patients when they have this sort of sequelae. And as a last item, I would like to mention the creation of scientific evidence and literature. If we take down the indicators to obtain specific information, this will be very important to share successful experiences with other units so that we will be able to implement them and encourage specific successful care of these patients. We must publish then these clinical guidelines. As I said, it's not only preparing them, we must share and analyze them and further elaborate on them together with other units to implement them in each of our countries and all units, and of course in the different regions to have success. All human beings are entitled to health, and particularly children. We must protect children. That, of course, are the present and future of humankind. So successful experiences must be shared by scientific publications, and nurses must work more on research and dissemination of publications. We must work harder there to share all this, so that in this way we will be able to give the basis, the scientific basis of our actions. So the basic message or take-home message is that we're facing a very severe problem with important incidence of sequela in premature newborns. More specifically, at present, we're referring to retinopathy of prematurity, and it is essential to conduct prevention. Prevention with all the items as mentioned. We must discuss and share guidelines, have them in writing available in all our units in such a way that we will be able to identify risk factors in a timely way in order to conduct a specific diagnosis and treatment in the right time, so that these children may have and prevent disability and recover children. We remind you that these patients are not only affected specifically in the vision area. Unfortunately, these children systemically are affected throughout their lifetime in all aspects, emotional, physical, psychological, with the constraints as mentioned before, but with important conditions at other levels, in the family, in the community, and in the countries. Because specific investment in this sort of patients for their recovery in the future have significant consequences at all levels, in such a way that comprehensive care and pediatric care follow-up is fundamental, and it's fundamental then, and it's the responsibility of all the health team, but the nursing staff is key. It's very important from my standpoint to remind all nurses that we participate in all prevention areas in all stages, and we are key there. We must increase awareness and become responsible in all stages so that our patients have the best prognosis. And remember that with quality assessment, survival quality assessment, we improve the effectiveness of care, not only measuring what we do, but also elaborating and to refer to outcomes and specific care.
Y bueno, pues para finalizar, obviamente, con esta presentación.
So now, wrapping up this presentation, it's important to remember that the children are not the future, they're the present. And of course, the quality of the care we provide them will result in a better future for them and for us as the players in health. So with this, I finish my presentation. Thank you for your attention. That was an excellent presentation. Thank you, because really, from the regional perspective and then the initiatives in Guyana, your presentation, you approached the quality of care in neonatal units and the involvement of the healthcare team in an integrated manner. That is, and the engagement of the nurses is key to prevent and to approach the retinopathy of the premature. And I'd like to highlight a question that Dr. Susan Niemeyer said in the chat. What is the role of kangaroo care in the prevention of ROP. And we agree that it is essential in this integrated care that we provide. So it's not just watching and make the best use of technology to provide a better quality of care, but also to consider the approach that kangaroo care provides in all respects. So in this context then, and after these excellent presentations, we'd like to share a video with you, a video that gives you a general overview of the course that we are about to launch. So, and we want to invite you to take this course, to disseminate it, and to promote its access by the healthcare teams. Can we share the video, please?
15 millones de bebés prematuros nacen cada año. 1 millón de ellos muere debido a complicaciones. Otros se ven afectados por diferentes condiciones, incluyen desde trastornos del aprendizaje hasta alteraciones visuales. Muchos de ellos no son tratados a tiempo de enfermedades prevenibles, como la retinopatía de prematuridad, causando incluso ceguera. ¿Qué es la retinopatía de prematuridad? Te invitamos a hacer un recorrido que te permitirá conocer qué es, a quién afecta, cuáles son sus causas y consecuencias, y quién es el personal de la salud responsable de brindar los cuidados necesarios para su prevención, diagnóstico y tratamiento.
Este recorrido se compone de distintas piezas audiovisuales e interactivas, que lo convierten en una experiencia de capacitación única. Estos recursos incluyen módulos interactivos, videos, pantallas interactivas, una sala 3D, escenarios, recursos gráficos, actividades y muchos recursos más. ¿Estás listo para descubrir todo sobre la retinopatía de la prematuridad? ¿Qué esperas para inscribirte? Ingresa a la plataforma de la OPS. Toma el curso, aprovecha el contenido al máximo y conviértete en un experto en retinopatía de la prematuridad.
Muy bien. Y ahora entonces...
Very good. So now, hopefully, the video has motivated you even more together with the presentations so that you'll be willing to take this course. Let me just share some aspects with you about the characteristics of this course and tell you a bit about it. We already talked about the importance, both from the point of view of births exposed to retinopathy and also the implications of the conditions at birth and how it can impair health and quality of life and the social capital. And as Dr. Silva pointed out, And this course is the result of a path that we have followed much earlier than 2016. In 2016, they published this paper that Dr. Silva mentioned, getting to know what happened in the region and the availability of policies and national guidelines, the law, and information system that may enable us to survey and to monitor the impact of ROP. And this analysis led, at the same time, in 2016 and 2017, led us to develop and then to launch the clinical practice guidelines for the management of retinopathy of the premature as a regional guideline proposed to be adapted to the countries in terms of responding to needs. So, in this brief summary, now in 2021, we are presenting this course that is essentially based on the clinical practice guideline that the Pan American Health Organization has developed and published. The purpose of the course then is that the participants may learn knowledge and strategies and their proper implementation and the timely management of ROP with healthcare teams working at NICUs. And specifically, the course is geared so that the participants may identify the risk factors for ROP and may know the system of classification of the evidences using the grade evaluation to get to know the recommendations in terms of the risk factors or protectors for the occurrence of retinopathy, and also the recommendations in terms of the usefulness and the timeliness of retinopathy screening. And finally, as the final specific objective, it is to perform and to timely and adequately implement screening. Although we had presentations of colleagues of different disciplines, this is a course that is aimed at the entire healthcare team, nurses, general practitioners, obstetricians, midwives, gynecologists, pediatricians, gynecologists, and the professions involved in the management and the administration and the development of policies. Policymakers. So as we saw in the video, there are 6 modules, and we assess the impact of retinopathy, we characterize it, and we provide elements to interpret the recommendations, present the recommendations in terms of diagnosis and screening, the basic characteristics of the NICUs to enable the screening of this ROP, and finally the care that needs to be administered to the newborn. So this course today, we wouldn't be able to launch it without the participation of a number of departments, the virtual campus, the people of course of life, research and health, and the group that developed the clinical practice guidelines, that is a group of professionals of top level that contributed to the development of the guideline, and to neonatologists and the Colombian Society of Perinatology and USAID that gave it support to develop this course. So the challenges, and with this, I'm just summarizing what the colleagues said in the previous talks. So now our job is to disseminate this course and to promote the people's access to the evidence available and to promote competent and motivated, empathic healthcare teams, multidisciplinary teams, and organized in networks to provide an integrated and comprehensive care, contributing to equality and focusing on newborn and family-centered care. So in this context, we hope that the course may be of use and user-friendly to contribute to the improvement of health and the quality of life of boys, girls, and their families. So with this, thank you for your attention. And with this, I'll give the floor to Dr. Sarruya, who will close this session. Thank you. Thank you, Pablo. My congratulations to all. More than 300 people participated in this launch, and this shows the importance, the interest, and the commitment with the health of newborns. Right now, well, I wanted to thank you all. That is the Latin American Center for Perinatology, Women's and Reproductive Health. Please get in touch with us if there are any questions. Get to know our courses and see the resources that we offer, because we offer many resources to ensure a better care. And we are very grateful to all those that participated, the speakers, and all of you that stayed with us until now. So I also want to thank the translators. We had the pleasure of having several languages, and the streaming people, and our journalist, Ana Artigas, who helps us with the communication so that these courses may reach many people. So thank you all. I wish you an excellent week. Now open your cameras, because we're going to take a picture of everyone. So now, please enable your cameras, all so that we can take a picture of everyone. I see Juan Carlos. Hello, Juan Carlos. Pablo. Jovita. Dr. Sogrim.
Thank you so much.
Thank you. Dr. Sarruya is thanking you. Bye-bye. Thank you. This was an excellent day.